Hey everyone, this is Jhaveri, aka the Urban Nerd, and let's get right to it. The last remaining 5 telemedicine tips. Here's tip number 5. Tip number 5 is basically answering the question, when can I do a telemedicine consult? I found this amazing, cool flow chart provided by the American Academy of Family Physicians, AAFP. And basically this diagram kind of shows you exactly what to do if you want to do a telemedicine consult, and it's a pretty good decision tree on exactly what to do to all the way to the coding, which comes to my next tip. Tip number 6, and this is probably the most important tip that everyone has asked for, is how do you code for telemedicine? So coding for telemedicine is based on a number of factors. First, you must look at your state parity laws in terms of reimbursement. Below, I have attached a link where you can see each of your state's laws regarding to telemedicine reimbursement. So in the description below, I'll be including links to all sorts of resources and attachments to help you guys. Second, with COVID at the moment, you're allowed to see Medicare patients in any state. You don't have to be licensed to see Medicare patients in other states. However, this is temporary with the current situation going on at the moment. Now, with Medicaid patients, it's a little bit different, and that is being varied based on the state. So look if a state is supporting seeing Medicaid patients if the provider is not licensed there. So the question remains, what CPT codes are appropriate for these type of telemedicine appointments? The answer depends on a number of factors. A good rule of thumb is to use the same coding standards that you would use for an in-person appointment. In the healthcare industry, however, relying on a good rule of thumb is not always the best practice. A perfect example to explain is, let's say the service you're providing is an office or another outpatient visit. The CPT codes for this is 99201 to 99215. Contained in this set of codes are 2 of the most common CPT codes for outpatient physician offices, 99203 and 99213. Where 0 indicates a new patient and 1 indicates an existing patient. Reimbursing the national average is around $73, but how can you achieve the complexity requirements for a level 3 office visit without a physical exam? The documentation for these encounters require 2 of the 3 of the following components. One is an expanded problem-focused history. Second is an expanded problem-focused exam. Third is low complexity medical decision making, or a 15 minutes spent face-to-face with the patient if coding is based on time. So for an example, if a provider reviews results of a recent lab test for a patient and adjusts their medication accordingly, this visit meets the complexity requirements for a 99213 visit. However, as usually the case with telemedicine, it's not that simple. So when I say it's not that simple, it means that if you're having a patient that's using Medicare, they are not using these CPT codes. Their codes are a completely different set. And also for CMS, they require a modifier. So next to your CPT code, there is a modifier field. And usually the modifier field is usually a modifier of 95, and which is fairly a new modifier, and is only used when billing to private payers to indicate services were rendered via synchronous telecommunication. It's important to note that Medicare and Medicaid do not recognize modifier 95, but what Medicare and Medicaid do recognize is the POS 02 as a modifier. So POS means place of service. And according to CMS, POS 02 is defined as the location where health services and health-related services are provided or received through a telecommunication system. CMS used to have a modifier of GT, was their modifier, but they replaced that with POS2. And POS2 can be used when billing CMS claims for synchronous telemedicine visits. But how do you know when to use each code? The only way to find out is to really call your payer and to find out their policy for telemedicine visits. If you ever called an insurance company, you know this is a very labor-intensive process. So as a favor, in the description below, I've attached a link where you can download all the codes and information that you need to submit your CPT codes with the modifiers or your HCPCS code, regardless of the type of provider you are. This includes video and telephone consults. Tip number 8 is about consent forms. Regardless if it's a new patient or an existing patient, you must have that patient sign a telehealth consent form. In the description below, in this video, I've done you guys a favor and I've attached a sample template that you guys can use. However, currently, since the restriction have been removed during this coronavirus time to use a HIPAA compliant video platform, and you can use any non-public facing video platform like FaceTime or Skype or the free version of Zoom, you still need to obtain a consent from your patient. And in that consent form, you must include any waivers of risk that could occur during a breach on these non-HIPAA compliant video platforms. So just make sure that your patient knows that you're using a non-HIPAA version of your telemedicine platform, the video technology, and make sure you do obtain consent in regards to that. This is to protect yourself or your practice. My form that I've attached does not contain a version that covers that. So if you are using FaceTime or the free version of Zoom, Skype, or Google Hangouts, make sure you modify the template to include whatever service that you're gonna use in the consent form. Now, if you want to send your consent form, you can send it via email to your patient. I use a platform called DocuSign. I think it's very easy. Some of you guys may have heard of it. DocuSign basically allows you to send a form digitally to that patient and they can sign via online legally. It's a great legal platform. There is a free version or a free trial that you can use that limit how many consent forms you can send out, and they do have a monthly limit, but their subscription version is actually really affordable and super cheap. So that's something to look into, is if you want to make sure you aggregate all your consent forms in a legal platform, DocuSign is a very great platform. Tip number 9 is about the environment that you want to conduct your telemedicine consult. This one's kind of obvious. So whenever you do decide to do a telemedicine consult, make sure you're in a private, quiet room with great internet or data speeds. I also recommend testing out your video platform and set that up before the scheduled consult. What you can do during a consult can actually vary. Obviously, you can't do a physical exam via video. However, you can discuss lab results or medication or any documents or medical scans that you have on file, or if the patient sends you. You can also do screening questionnaires, and mainly basically doing anything you can do remotely without being physically there with the patient. If you have clear enough video, you can perhaps able to view any rashes or skin conditions or anything related that you can see physically to get a better sense to help you diagnose your patient. There are platforms out there that allow you to do screenshots of your screen and it's stored in that platform. However, you absolutely cannot take screenshots of a video consult that would be locally stored on your personal computer's hard drive. So if the platform supports screenshots, if they have a screenshot tool, use that. But if you're using your screenshot option within your personal computer, don't use that. That's not HIPAA compliant because you're storing information, a patient's information, or even a photo of that patient within your hard drive. So that's, you guys know that it's not HIPAA compliant. Also, if your telemedicine platform supports any remote monitoring devices like the Echo stethoscope or the Kinzo or Bluetooth enabled otoscope or pulse oximeter, you can actually conduct certain exams using those tools and actually bill for those as well. So once again, attached in the bottom below is a link that has all the CPT codes for remote monitoring devices and all the other CPT codes alongside with it. The last tip number 10, is going to answer the question, what platform should I actually use for telemedicine? Earlier, I talked about platforms with the correct video technology, but obviously that's not any help to you guys. So I want to get into specifics and actually helping you guys pick the correct video platform to choose. So right now, since the restriction have been removed on using a HIPAA compliant video platform, You can use the free version of Zoom, which gives you 45 minutes of a free call. You can use Skype, you can use FaceTime if you want to give your number out. But out of all of those options, I really recommend Zoom because A, it's free. 2, 45 minutes of a free call is more than enough. 3, you can actually have up to 50 people on the call. Obviously, you won't need 50 people, but if you do want to do a multi-provider consult and you want to have 2 or 3 providers on the call, you can easily do that with Zoom, and you cannot do that with the other platforms. And lastly, 4, the video compression is amazing, so you don't have to worry too much about your internet speeds. Now, if you're looking for a long-term solution and you do have that budget, there's quite a bit of amazing platforms out there. And my 4 most recommended platforms are SnapMD, PatientClick, Mend, and Chiron Health. If you're a nonprofit, free versions that you can check out and actually talk to these companies to get that free version or a discount are PatientClick, InTouch Health, IntelliHealth, GoTelecare, SnapMD, and AMC Health. All the links to all of these companies are in the description below, so click on those links, find out more information, contact them if you're a nonprofit to see what discounts or if you can get a free version of that platform. Those who are looking to integrate, a video platform or a telemedicine platform to your existing EMR, the best one I do recommend is Chiron Health because they have this amazing AI insurance coding rules engine. So this way you don't have to worry about figuring out what payer supports what code and what type of CPT code is correct. And the other one is Mend, which integrates with the majority of the EMRs out there. And they even have add-on features like a scheduler to make the process a lot smoother from patient to the provider's telemed consult to notations into your EMR. So highly recommend Chiron Health and Mend. There you have it, the last 5 remaining tips. If you haven't done so, check out the video above of the previous 5 tips. And just what I said earlier, everything I talked about in this video, including all the resources, the consent form template, the CPT codes, are listed below in the link in the description. And let me know what other topics you want to hear next. You can leave a comment below. You can send me any questions on Instagram at TheUrbanNerd, or you can email me at contact@rajjhaveri.com. Until next time, this is Raj Jhaveri, and thank you for watching The Urban Nerd Show.